Hi, I'm Natasha Tracy for Breaking Bipolar here at HealthyPlace.com. Today I'd like to talk a little bit about antipsychotic medication. Now, when I started medication, I was depressed, and they didn't know I had bipolar disorder. So I took an antidepressant. This made perfect sense. I was depressed. I took an antidepressant. Along the way, it was discovered that I did have bipolar disorder, and so then we started trying mood stabilizers. Again, this made sense. I had an unstable mood. They were going to fix that with a mood stabilizer. But at some point along the treatment, things weren't working quite as well as we would have liked, and my doctor suggested an antipsychotic. Well, I didn't want that. And there were two reasons that I didn't want that. The first of which was stigma. I considered the fact that an antipsychotic, the name alone meant that I was psychotic and therefore crazy, and I didn't want to be associated with being psychotic. I thought that there was something wrong with that, and I thought that there would be enhanced stigma around me. And then the other reason was because I had heard that the side effects on antipsychotics were quite dramatic, and I didn't want those. Now, the second part of that, yeah, I was correct. The side effects are quite dramatic, or can be. But I have seen both very positive and very negative reactions to antipsychotics, and those reactions have nothing to do with whether the person is actually psychotic or not. Now, psychoses isn't actually all that unusual. Many people will experience a psychosis at some point in their lifetime. Often it will be a one-time occurrence. And there's nothing wrong with admitting to a psychosis. I had internalized stigma about it. I didn't want to be associated with it, but that was a limitation of my own knowledge. That was a manifestation of my own ignorance. Antipsychotics are simply another class of medication. No one goes into their doctor and says, I only want to take medication from a specific class. What matters is that the medication works, not what you call it. My name is Natasha Tracy, and this is Breaking Bipolar.